SOAHAC's mission is all about bringing health and wellness to the Aboriginal communities we serve by blending Western best practice with traditional forms of medicine and Indigenous wellness. The major access issues that have been identified and continue to be of issue in Ontario is really relating to primary care, so access to docs, nurses, dietitians, and also access to the broader health system in general for specialized services, and also to have a place where we could formally develop culture-based Indigenous informed practice.
I always thought that, like in my mind anyways, the way I describe it, I always think that the way that our traditional healing services or our traditional elders, how they've always been taught to provide services were naturally a natural integrative process. They've always been operating and providing service to people within our communities for hundreds of years in an integrative manner. And I think that the mainstream way of providing primary health care services or wellness services is just now catching up to that, so that we're able to integrate those services in a much more, I would say, holistic manner. It's the spiritual realm that's lacking.
SOAHAC's area for service delivery is pretty expansive in southwestern and Erie St. Clair Lynn area of the province. Our initial catchment area is for London, Chippewa of the Thames, Munsee, and Oneida First Nation. We've been expanding our services over the last 5 years to include Owen Sound, the Chippewas of Nawash and Saugeen First Nation, and the counties surrounding that area, as well as servicing the urban Aboriginal population of Windsor and Caldwell First Nations landless band that's situated there in Leamington. We're stabilizing comprehensive, holistic staff teams at each of our sites for more comprehensive continuity of care for each client and their family, depending on the needs of those clients.
My name is Grace Rosat Lasala, and I'm a nurse practitioner. I work here in the Can-American Indian Friendship Center in Windsor, and on Wednesdays I travel to Leamington in the Caldwell First Nation. I'm able to do their physical examinations. I'm able to request for blood works, other diagnostic tests, and do the treatment as needed, which will also entail prescribing medications and sometimes referring them to specialists as needed. What makes this unique is that the patient will be able to direct the plan of care that he or she wants. For example, being a nurse practitioner and with the training in Western medicine, we have to acknowledge the cultural component part. So if the patient or the person requests for a traditional healer, we need to be able to provide that for them so that their emotional and spiritual well-being are met, because it's not only about the physical aspect that we need to take care of, but also the emotional, mental, and spiritual well-being.
I moved here 4 years ago, and I was unable to get a family doctor. Fortunately, I was able to get a nurse practitioner just within this past year, but I really am planning on switching over to have Grace because I like her nature and I like the fact that she's Indigenous and we share that same connection spiritually, which is really important to me as well.
My name is Lin Yuan Su. I am the Integrated Care Manager for SOAHAC Chippewa of Thames First Nation site. At SOAHAC, we are serving such a huge area. We're serving multiple communities, First Nation communities. We are right on the land of Chippewa of Thames First Nations. Close by, we have Munsee Delaware First Nation and Oneida First Nation. With the expansion, we were able to meet more needs, but that being said, there are still areas we can certainly expand to better serve the communities.
I'm Mike Vergenhill. I'm the physician at the Chippewa site. There was only a few employees when I first started, but then as the trust from the community developed, it turned into a more full-time position. We've always had traditional healing, but we've also added on things like physiotherapy, mental health and addictions, diabetes education team, and other services like that. At our site on Chippewa, at least the access is a little bit better because they don't have to travel into town or into London. So they can get a complement of services here, everything from blood work, like I said, to physiotherapy, to other services that they couldn't get normally with a family team.
My name is Summer Brissett, and I do the Traditional Healthy Lifestyles program here at SOAHAC. I have a fairly broad scope with my program. We have 4 different program areas. So the first area is healthy eating, active living. We also do the Smoke-Free Ontario. We also have Healthy Kids. That's been a new addition to the program over the past year or so. And the other program that I do is diabetes prevention. So a lot of the activities sort of tie into each other in terms of promoting healthy eating and active living.
As we expanded to multiple programs, the integrated care model is basically involving everybody with the client's care. So the clients will make informed decision as of which services they would like to receive. Could be from a doctor, could be from a nurse practitioner, could be from a healer or a dietitian or mental health worker, so on and so forth. They will be able to make the decision because we offer such a diverse part of services.
You know, that's the exciting part of my job, and it makes it a joy to come in and you know, meet with our community members and meet with, you know, the elders and facilitators that we have or that we also work with.
My name is Lisa George. I am one of the integrated care managers for the Southwest Ontario Aboriginal Health Access Centre at the Owen Sound site. We started this site about 2 years ago, just a little over 2 years ago. We have a nurse practitioner who provides primary care services. So she has 1 day a week out at Saugeen, 1 day a week up at Nawash, and she has clinic here the other 3 days here in Owen Sound. She does blood work, referrals to specialists, prescribe medications, pretty much whatever is required that you might need from almost a family doctor.
So I find that a lot of the clients that I've worked with in this area have had some negative experiences with the healthcare system. Again, either with access issues, so they're not able to get to their healthcare provider, or they're not able to find a healthcare provider that's accepting patients, or they've had some negative experiences in that they've experienced racism either directly or indirectly. They felt that they've been treated differently than other people get treated. A part of what I do is I go out to the reserves to increase access of healthcare for those clients. And I believe with my cultural competency training and my experience, I strive to provide care that is non-discriminatory and culturally sensitive.
Most of the clients that come here are First Nations Aboriginal community members from the City of London. And they come here looking for, we have homeless people that are coming here looking for primary care. We have clients that will come here looking for traditional healers. So we have a lot of different services here at SOAHAC that they can utilize.
This past fiscal, we served 6,000 clients and we had about 14,000 client encounters.
We've really embraced the collaborative approach to real client-centered care. So we tend to work with patients kind of where they're at right now. So we've seen the team grow drastically, you know, from just a couple mental health workers to, you know, I think there's 6 or 8 right now, and expansion within both the sites. So there's just a lot more access for people. I always call this kind of your one-stop shopping. So it used to be that you had to go to various places to access different services, and now you can come to SOAHAC and see a variety of different people, sometimes in the same day or even at the same appointment.
SOAHAC has 2 downtown sites right now. We have our William Street site and the Dundas Street site where we are now. We are undergoing a major renovation here at the Dundas site, so we're about 1.5 years from amalgamating our services into this one building. William Street we own outright. We probably will continue to operate some type of programming out of there as well.
We have developed a provincial-wide Indigenous cultural safety training program online now for professionals inside the healthcare system to address inequities and to help with the cultural safety development inside the healthcare system. So we're not just addressing the delivery issues, the issues around service delivery, but also the broader systemic issues that are impacting on keeping disparities and inequities in place.
It's really important to have a cultural specific program here because of the impact that's gone on with our people historically, not feeling safe going to a Western model primary care, whereas coming here, it's a safe place for them to come.
Outreach can be also information. So with our FASD program, for instance, we developed a lot of support materials for workers in the field to help them identify ways of supporting people living with FASD and their families to better moderate their illness, but also deal with the daily issues of living with FASD.
As a fetal alcohol worker, it was support for families of caregivers, individuals. So I'd help them go through the diagnostic process. Just the paperwork, the forms, the referrals. I would do the assessments, the screening, and if they had a positive screen, then we would move forward to getting them referred and getting them diagnosed. We help them with the paperwork for ODSP or next stages. We do advocacy in the schools. We do education, but we also work creating plans so it becomes part of their individual learning plan. And then we also would include the cultural piece in it. What cultural pieces could they use in the school?
One of our elders say, if it was just a matter of increasing access to primary care, we'd all be well, because our communities have we have more access to doctors and nurses than we've ever had, but we're sicker than we've ever been. So it's not just about that. It's also about dealing with the intergenerational impacts of trauma. It's about addressing the impacts of residential school, the 60s scoop. It's about helping communities rebuild themselves, to recover their identity, strengthen their ability to deliver health care in a way that makes sense for them, in a way that's going to have meaning for them, in a way that's going to actually make a difference and have an impact.
My name is Miranda Hill. I'm a nurse practitioner working in the SOAHAC program, so that stands for Supporting Aboriginal Seniors at Home. So I serve Aboriginals who are age 55 plus, who live on reserve. So I do home visiting, and I also see them in the clinic here. A lot of the people prefer the home visits just because I have a lot of clients with mobility issues, just getting out of hospital. They're very ill, they have multiple comorbidities, so it's a lot easier for me to go into the home to see them. They really appreciate that. I've found in the past that when this service wasn't available, they would be calling the ambulance and going to emerge just because of the mobility issues, or they would be missing appointments. So opening up that access to go into the home really decreases the barriers.
A lot of the emphasis in this population is early detection of chronic illness like diabetes, hypertension. So a lot of drawing blood work on a regular basis, making sure people are okay. We do a lot of triaging of people with mental health problems, a lot of issues around addiction, so getting people to treatment centers and linked with appropriate addiction services here at SOAHAC or elsewhere.
It's really essential that Aboriginal health be in the hands of Aboriginal people. It's critical to our survival as people. Until Indigenous communities are the ones who are informing service delivery and its processes, we won't see the change in health that we're aspiring to.
For the Aboriginal population, one of the big words that we would say is empowerment, right? Because traditionally, our people have been through the process of colonization, we've been disempowered, and that's really affected our healthcare quite a bit in terms of like our physical health, our mental health, and wellness and well-being, and how we interact even with each other. Many of our people have gone through a process of experimentation, scientific experimentation in Canada, and some of those have traumatized the Indigenous population to the point where they might even be afraid to come through the doors, right? So through that process of colonization, the power has been taken away from them to make their own informed choices about what they want and what types of services they need.
Because when we take a holistic approach, we're involving their culture, their value system, their belief system, their family, their community, cultural strategies, cultural ceremonies. And so the medicines were there, the teachings were there. And then we would also bring something in that they could learn from to put into practice.
In the holistic way we look at helping people identify their needs spiritually, emotionally, psychologically, and mentally. So while in the mental health and addictions, we might focus maybe a little more on mental health and emotional health, we also have all of these aspects in mind, the whole person. And when we talk to them, we help them identify their needs and create a care plan and a circle of care, which involves many services.
Some individuals have been displaced in terms of their home communities, so it's looking at that connection that they have to the resource supports that we have here and the Aboriginal supports that we have here. And I think that when individuals come in, that's something that they will often say, you know, it's just so nice, it feels like we're coming home.
From my experience, many people don't know the legacy of residential schools and the impact it's had on our individual families and how it was brought back to our communities. And that's what they call that transmission. So a person didn't have to go to residential school to have that fear syndrome. So they're getting a lot of Indigenous teachings. They're getting used to being in group with other participants. So it's getting them prepared for residential treatment, where the majority of that is based on group counseling. I feel it's very successful, and people feel really supported, that they're not basically crazy for the experiences that they've encountered. It helps them to recover and tell their story and to move beyond the trauma.
What's really important is an understanding of the historical context. That kind of understanding, I think, allows for a compassionate and caring perspective. They don't feel judged, and they feel like maybe something good can happen, you know, that maybe they'll get the help they need. So we put a lot of effort into making sure that we are culturally safe.
Culturally relevant programming is effective in the work of health promotion, encouraging, you know, a lot of the initiatives that we're involved with smoke-free, with healthy kids, with healthy eating, active living, and diabetes prevention. And I think that's the real strength of the program, is that we're able to bring in that cultural knowledge to do this work.
An area of development at SOAHAC this past year was the Ministry of Children and Youth Services asked us if we would become a coordinating agency for telemental health for Aboriginal children and youth for what they consider Area 4, which is our catchment area plus the northern part of the province going into as far up as North Bay. It's a large geographic area, and we work very closely with the CPRI, which is a hub for telemental health. So this is a place where people go to get access to telemental health, telepsychiatry for children and youth.
It helps to be able to identify some of the mental health issues at an earlier age, so that it's not as a strong impact when they get older and they haven't been receiving services. So we're able to get assessments done earlier. I think that it would help the children and youth that we're working with now, when they become parents, that they might be able to do things in a different way than the way that they were parented.
Telemental health coordinator takes referrals from mental health providers in First Nation communities, in urban Aboriginal communities, and Métis settlements to identify whether or not they're a good candidate for the specialized service, and if they are, to help ready them for that time. So making sure there's telemedicine equipment in their communities, where they would touch down, and basically be that support for them to understand the service and how they access it.
It's not counseling per se, it's more of empowerment and peer mentorship. So, we'll see a youth and we'll try to help guide them and navigate them through their lives and the difficulties that they go through, especially in their teenage years, as they're coming into their different hormones and their different changes that they're going through. We find that through ceremony and culture, it helps to battle some of the mental health issues that are in the communities, because when the kids know who they are inside, their identity, and they get help to clear some of those issues out, then they're more resilient. So we're hoping, that we can give them the tools that they need to help them to succeed in life.
We cover a big geographical area where there's different cultures. There's Oneida, who's the Iroquois Haudenosaunee, and we also do, we have the Munsee and Chippewa, who are Ojibwe, so there's different cultural practices there, and our traditional healers are equipped with everything to support the different traditions that people come in with. I think it's very important to be able to offer that in addition to Western medicine, just because people may not feel safe or comfortable attending a physician's office or a nurse practitioner's office if that service wasn't also provided.
Our entire service attempts to support an individual from that holistic manner. So in terms of Indigenous focus, it's recognizing the history that often our Indigenous population has been through in terms of colonization, and to acknowledge that that's happened, and then to be able to support them with those traumas, as well as why there might be reluctance to access mainstream services, and why there may be some more comfort with having Aboriginal people providing them their healthcare service.
You know, there continues to be health inequity amongst Aboriginal population and mainstream population. You know, we just want to close that gap and make sure that the services that we receive are appropriate and on par with the mainstream population.
I think our primary healthcare staff are quite informed now that they might have to take a little bit more time, especially in the beginning process of diagnosis or even intake with some of the Aboriginal people, because there's an exploratory stage that goes through those. They want to storytell, and basically they want to find out who you are. You know, like and what you're about. They want to. They're performing their own assessment on the doctor, per se. So making sure that it's going to be safe for them.
We always have to be aware of that context. So we're not just providing a healthcare service. We're not just handing out prescriptions. We're actually a thriving part of the recovery of our communities in the fullness of it. So you know, one of our elders keep on saying, "What are we going to do when we're healed?" So, you know, SOAHAC wants to be around for that time when we can really say, you know, yes, our communities are healed, and now we are more about, you know, determination and health, defining for ourselves how we are going to indigenize our health process, how do we continue strengthening the Indigenous health systems, and how do we ensure that our health care structures and systems are actually informed by Indigenous people.